Alright, so I'm Dr. Brad here at Health First Spine and Wellness. We've got Chris, one of our budding upcoming superstar triathletes here with us today. And noticing ankle pain, tightness in his calves in different areas after strenuous bike and run workouts. So we just want to look at his ankles and kind of evaluate them. And Dr. Tony, if you get a shot of this right here, you can just kind of look and see how this ankle here is kind of pointed more, kind of pointed down more than this one over here. So there's some asymmetry in his plantar flexion. And we're just going to check this here. And he has virtually no dorsiflexion, much worse on this left side than the right side, which means as he's running, it's putting asymmetrical stress on his body, which can lead to a whole host of different things. So the one thing we want to do is we want to check this talus here, the lower joint in the foot, and adjust that. And we already did that a little bit earlier. And basically, we can use some manual procedures to increase the range of motion in the joint itself. Then we need to address the soft tissue issues in the lower calf complex here, and the soleus and Achilles tendons. And come back here with me, Chris, and we're going to kind of show you how to do that. So as we come back here, Chris has been doing a lot of stretches before, his activity, and we want to have him doing myofascial work before he actually does the stretches to break up the trigger points, the knots in the belly of the muscle, so we get a better range of motion. So Chris, why don't you go ahead and just do that foam rolling on that one ankle there. And we did this a little bit earlier, but a couple of key things in your foam rolling. Number one, make sure whatever you're rolling, that part further away from the roll is actually relaxed. And when you find those tender knots in there, you want to hold pressure on it, move the ankle around just like that to kind of break up some of that scar tissue in there. So you'd go on the outside, you would roll and do the front like this and go all the way onto the inside, working all around that complex wherever is most painful. You'll spend a few extra minutes on there. You're better off doing 2 or 3 sessions a day at 1 to 3 minutes at a time instead of doing one marathon session of 10 to 15 minutes at a time. Then the one stretch I like to do is from that kind of kneeling stretch. This is really something pretty passive where you will just kind of keep the foot flat on the floor and you're just basically leaning on that knee. You can do this when you're watching TV, so it's actually pretty comfortable. What he's doing now, the pulsing, we don't want to do necessarily. What we want to do is we want to kind of get that muscle, that tissue to tension. And we want to hold it and see if we can get that to relax. And as that relaxes, we'll go a millimeter or 2 further into it. We'll breathe, try to get our body to relax, going into the tissue there again, and slowly increase that up to maybe 1 minute to 2 minutes maximum in this position. Switching, and we're going to do both sides. I'm just going to show you the one for now, but we'll end up doing both sides. Very good. You see this side's got a lot more range of motion on it. I don't know if you can see that on camera, but it does. So we want to always try to get those more symmetrical. Then the other stretch we'll do is just the standing calf stretch. So Chris, why don't you going to do a standing calf stretch, traditional one. I'll put a couple of things that are important. Get from behind here, Dr. Tony. So I want to show this first. One of the most important things we're going to do is make sure that this heel is lined up with the foot. And again, the calf is one of those that's a very strong muscle but can be injured as well. So we want to not stretch it too aggressively. We want to make sure that we are being gentle with the stretch. We should feel better range of motion as the muscles is relaxing and not forcing it too much. So again, if you're having lower ankle issues or calf issues, remember pain is never a good sign, especially if something's happening recurring after all your training sessions. You want to find the underlying cause, like in Chris, it's from old ankle injuries that never got completely rehabbed. And we're going to go through now and start rehabbing that so he can continue to compete for many years to come. Thanks for watching. Have a good day.